Hello, welcome back to this next video. So in this video, I'm going to talk through the theory behind the capillary blood glucose monitoring stations. This is one of your clinical skill stations. It's 8 minutes, relatively straightforward to complete. But obviously, as with all these stations, we need to know what we're doing. We need to be able to explain that to the patient, and we need to understand, what do we actually do with those results as a nurse? What's that kind of post-procedure follow-up and advice, which is a really important part of this station, which is often forgotten and can be a fail. Okay, so in relation to your NMC OSCE, this is an 8-minute station, and you basically just have to take in the blood glucose correctly. You need to document your results correctly on the sheet provided. You need to demonstrate your understanding of what normal blood glucose levels should be, and you need to verbalise and demonstrate your nursing knowledge and your follow-up actions and advice depending on what your blood glucose result is in your station. So what is capillary blood glucose monitoring? So it's a method of measuring the concentration of glucose in the blood. And we do that by taking a small amount of blood from the finger. And this is a really, really commonly used procedure and way to manage monitoring blood glucose levels in patients, predominantly with either type 1 or type 2 diabetes. We might also be doing it as part of our A to B assessment in that disability, to rule out any primary causes that could be affecting that patient that we need to treat. So, like I said, predominantly used in diabetes management. We need to be able to know blood sugar levels, so we know how to treat, so what medications we need to give and whether it's safe to give medications, and also to understand how well that diabetes is being controlled, because obviously high and sustained blood sugar glucose levels can be very detrimental to the patient. They can cause lots of long-term complications with diabetes, such as damage to the kidneys, damage to the blood flow and nerve system in the peripherals, and so lots damage to the eye as well, retinopathy. So it's really important that patients manage their blood glucose effectively. Obviously, our blood glucose levels will determine different treatment decisions. So when to treat, when to give medications, when to manage things such as hypoglycemia. And with blood glucose monitoring, it's a bedside test. So it does give us immediate results. If I was to send someone's, blood sample off to the lab, then those results would not be immediate. So it's a really quick bedside nursing procedure. And we do a lot of education around patients in terms of self-monitoring of blood glucose. So we need to be able to explain it correctly to the patient, and giving them the knowledge and confidence to manage their blood glucose levels safely outside of the hospital environment. So key considerations we need to think about when taking a sample. So obviously hygiene. We need to make sure that the hand is clean and the finger is clean, otherwise that will contaminate our sample. We need to make sure we're rotating the site, because if we're using the same site all the time, we're going to get soreness, we're going to get hardness under the skin, and we want to try and avoid the thumb and index finger, because this is obviously our really important fingers in terms of dexterity and doing things, okay? We need to make sure we get a sufficient blood supply onto the sampling strip, okay, to ensure we've got accurate reading. And we need to make sure that all our equipment, especially our test strips, that they're not expired, that they've been stored correctly and they've not been exposed to air and they're dry, because that is going to alter the reading. And that is really important because, like I said, treatment decisions will be made on your blood glucose levels, okay? So if we have incorrectly perform that procedure, then the results could not be accurate, and therefore the treatment we give could actually be quite detrimental to the patient if we get that wrong. So we need to know our normal blood glucose results. So linked in one of the additional resources on this section is the NICE guidelines for diabetes management and control. So this is where we get those readings from. So for diabetic patients, we normally look at a 4 to 7 millimoles per litre pre-meal and a 5 to 9 millimoles per litre post-meal. If your blood glucose level is less than 4, we'd class this as the patient being hypoglycemic, and in which case we need to immediately give the patient some kind of glucose-containing drink or food if they are awake enough, or some IV glucose solution or fluids. And it's in a medical emergency, and we should be informing the medical team, and we should be reassessing that blood glucose level within the next 30 minutes. If your blood glucose levels are greater than those nice guidance for management, so greater than 7 pre-meal or 9 post-meal, then we definitely need to be looking at the ongoing management of their diabetes. So things we would be kind of assessing and checking as a nurse. So we would be firstly trying to establish if that is normal for them, asking them to keep a diary of their blood glucose or checking their kind of readings that they have been recording, so we can understand if this is kind of a normal pattern of increased blood glucose or if it's been rising over time. We'd also want to check in terms of their diet, are they following the recommended kind of diabetic diet? Again, are they doing any exercise? We want to check that they are taking their diabetic medication correctly and as prescribed, and if they're experiencing any problems with that, which might be stopping them from taking their medication. And we definitely want to be informing the medical team, maybe the diabetes specialist nurse, because they need maybe a bit of a review of their treatment. So that is really important, because we do need to verbalise these action steps in our OSCE if we have a raised blood glucose level. So we're not just doing the skill, we're thinking about that nursing assessment, evaluation, and kind of that next plan in terms of interventions that we need to do. So going back to your OSCE, you're going to have your glucometer, your glucose test strips. You'll need some non-sterile gauze to place over the finger. Remember, you're going to have a sharps, so you'll need your sharp spin. You'll need your single-use lancet, okay? And you need, in the exam, you're obviously not taking a real blood sample. You're going to demonstrate taking the blood sample through the mannequin or the prosthetic finger, and then you'll have some blood in a little bottle or sample pot to put directly onto your test strip to get your reading. So paperwork and documentation. So again, you're going to have your scenario, and you're going to need to do documentation in this station because you're going to need to record your results. So again, we could have our scenario. So here we've got Summer. She's diabetic and been requested a blood glucose monitoring. Normally all your ID and allergy checks are done in this station, but just obviously read your scenarios carefully and check they have been done. And then you'll have some form of documentation, okay? It might vary a little bit between test centres, but normally you'll have a pre-meal and post-meal section, somewhere to put your date and time and somewhere to write your name and signature. So you do need to assess in your station whether the patient is pre-meal or post-meal. And post-meal is anything up to 2 hours from the patient having consumed some food. So how would I break this station down into those memorable steps so we can get through it in the time? So obviously key principles, explaining the procedure and gaining consent, checking and collecting your equipment. You need to do your finger checks, rotate the site and ensure the finger was clean. You obviously need to complete that blood glucose correctly. You need to dispose of your sharps correctly as well, okay? Not disposing of your sharps or unsafe sharp management will be a critical fail. You need to document your results, and then you, like I said, you need to verbalise any further actions if your blood glucose levels are high. If your blood glucose levels are normal, again, you can just check in with the patient that haven't got any worries and concerns, and that they're taking their medication and following their diet and exercise as normal. And just check with your patient at the end and end the station professionally. So key principles, again, you don't always need to do safety, but we'd want to ensure privacy and dignity. We'd want to decontaminate our hands using that World Health Organization 7 steps. Obviously introduce ourselves. If it's clear in your scenario your ID checks have been done, don't waste time on this, but obviously confirm what the patient would like to be. And the same with your allergies, that is normally completed, but just confirm that. Explain the procedure and gain consent. So how are we going to explain this procedure? So I might say, oh, hi Summer, so I've come to do your blood glucose reading. I don't know if you've had this done before, but it involves me taking a small needle and pricking the side of your finger and getting a small droplet of blood, and I'm going to put that into the monitor. And it's really important we know what your blood glucose levels are in terms of the correct management for your diabetes, and so we can make sure that they are within what we consider the normal and healthy limits, and whether, if they aren't, we just might want to make some additional changes to your treatment. So do you consent for me to do that? and then move on with the rest of your station. So again, like with all these clinical skills, really give it some thought and consideration about explaining that procedure. Okay, don't just say, I've come to take your blood glucose, do you consent? Because that patient might not have any idea what that involves. It involves a needle, it involves blood. That might be quite frightening for a patient. They might not, you know, want to have that done. So make sure you're really clear about your procedure, okay? But also, like I say all the time, it demonstrates to the examiner you understand what you are doing and why. So you need to go and collect and check all your equipment. So you're going to get, like I said, your glucometer. You're going to get your gauze, your lancet, your test strips, and your sharp spin. You're going to confirm that your test strips are in date. They've not been exposed to air and they're dry. And because you are dealing with a bodily fluid, you will need your PPE, apron, and gloves. So come back to the station. So we're back to the patient. We need to decontaminate our hands because we've returned to the patient as per those 5 moments of hand hygiene. You can put on your apron and then your gloves, and you can ask the patient which finger they used last time and just ensure you use a different finger. Okay, so rotate the site. Verbalise, not going to use the index or the thumb, okay, because these are our main kind of like fine motor dexterity type fingers that we need to use for lots of you know, day-to-day activities. So if we're repeatedly stabbing those with a needle, then we're going to get, you know, reduced some nerve damage and hardness, and it can make those activities a little bit more challenging. You don't need to clean the finger, okay? I mean, ideally, like, we would always just clean the finger with some water and gauze, but in terms of your exam, they're happy for you to verbalise that the finger is clean. You would not need to clean it. And then you need to perform your blood glucose, okay? So in the demonstration video, I show you the lancet and what you need to do with that. The test centre ones, normally you twist the end and then pull the grey cap off. You need to demonstrate where you would take the blood from the side of the finger on the mannequin or on the prosthetic finger. And then you need to get your blood, which may be in a tray, little pot, or in a little bottle, and apply that directly onto your meter strip. Make sure you're putting it from the top, so the blood is soaking down the strip and not putting it on horizontally like this. So it needs to be vertical, and you want to put the blood on the top and it seeps down into the strip. Verbalise, give the patient or the mannequin or the fake finger a piece of gauze and just ask them to hold that on. Put your lancet immediately into the sharp spin, okay, after piercing the finger. Wait for your reading, okay? Once your reading is confirmed, verbalise it, and then dispose of all your equipment and your strip into the clinical waste. You don't have to put the test strip into the sharp spin. It's not a sharp, but it does need to go into the orange or yellow clinical waste because it contains blood. Remove your PPE and decontaminate your hands. So you need to verbalise your results and document them, okay? Make sure you're documenting in the correct section pre or post meal. So ask the patient when they last had something to eat. Remember, anything within 2 hours is considered a post meal. Make sure you sign date and time, your documentation. So make sure you put your date and time in, you document it in the correct box, and you put your name and your signature in as well. So like I said, the NICE guidelines support the 4 to 7 pre-meal and the 5 to 9 post-meal. If your blood sugar is high, like I said, you need to verbalise kind of your actions and further assessments that you do with the patient. So think about asking the patient, is this normal? Is this a recent trend? Are they keeping a blood glucose diary? Are they taking their medication as prescribed? Or are they having any difficulties or side effects from that medication? Are they following, you know, the recommended diabetic diet? And are they doing exercise? You know, what's their lifestyle like? Are they drinking as well? Kind of all those things that can increase your blood sugar level as well. So you want to do that assessment and verbalise those action points and what you're going to do. If the blood sugar was low, so less than 4, then you'd need to verbalise, like I said, giving that patient some food or drink, and escalating this to the doctors and reassessing within the next 30 minutes. Then you want to finish your station. So obviously check the patient's comfortable, they've got the call bar if you're in hospital, or GP number if you're in the community, decontaminate your hands using your 7 steps, and always go back and double check that documentation. Can be quite a common fail that a nurse has missed the date or the time or the signature in that station, and it would be a critical fail. So critical fails in the station. So obviously any unsafe sharps management and or incorrect disposal of your lancet, make sure it goes directly into sharps bin after you have used it. If you fail to rotate the finger side or check that the finger is visibly clean, if you are incorrectly identifying the normal limits of the blood glucose, and if you do not verbalise your follow-up plan based on the results, that's really important. If you struggle with the machine and you don't actually obtain a blood glucose reading, that is a critical fail as well. So make sure in that pre-station briefing, you have an opportunity to be shown how to use that machine and you have an opportunity to have a go with the machine. You can do that in all your stations. You can have the opportunity, or should be given the opportunity, to be familiarised with any equipment by the examiner. And always don't forget your documentation. Absolutely crucial that you do that completely. Everything will need a date, time, signature and a name normally. And if you've got time left at your station, you go back and double check that.